Welcome to our Well-Rounded Mama YouTube channel. Thanks for joining us. If you like this video, like, subscribe, and ring the bell. Today, we're going to be talking about the midwife and your newborn. How does midwifery care affect the care and keeping of your newborn baby? What is in our scope and what is out of our scope? What do we do when something falls out of our scope? What kind of things do we offer? That is what this video is going to do, is talk to you about all of the services that your certified professional midwife can offer for you and the care and keeping of your baby. For starters, I do want to point out that as midwives, we all work as a global fee, which means all of your care and keeping is included, including the care and keeping of your newborn. So turning to a care provider who's already invested in your care prenatally and postpartum and labor and delivery wise is one of the best ways to make your dollar stretch the farthest. And so now to talk to you a little bit about why we're qualified and what we do to make sure that we're monitoring and keeping your baby low risk. Once you've had a home birth, within about an hour or two after delivery, what a midwife offers is a newborn exam. Camilla, would you like to talk to us about what kind of things we're looking for when we do a newborn exam for a baby at the home?
At home, we check the baby head to toe pretty much. We do measurements, we check the baby's weight. We are trained to identify what's normal versus what's not normal. We also check the baby's heart, we check the bowel sounds, head to toe pretty much.
That's great.
Yeah.
So essentially what you're saying is the same newborn exam that a pediatrician comes to the hospital and does is what we offer at home. We want to make sure that before we leave, you and your baby are completely stable and there's no reason for you to seek immediate attention of a physician. However, if we were to find something that was disconcerting to us, we know again how to refer out. And why again, we're superheroes of normalcy. Tiffany is a CLC as well as a midwife. I didn't even introduce them, these ladies that you're talking to. So we have Camilla and we have Tiffany and I'm Sherry. This is the first time that you're tuning in to us. One of the biggest things that a midwife can help with is the breastfeeding relationship. Tiffany, you want to talk to our clients about how we can help facilitate breastfeeding?
So what's really important after baby is born, that they have every opportunity to be uninterrupted from mom. Babies go straight to mom's chest unless there is something that we need to do, but we actually try to do everything when it comes to any intervention that we need to do with baby. We try to do it right there on mom. It's really important for babies to be connected and skin to skin with their moms right after birth. There's lots of studies and there's lots of cultural things worldwide with babies being attached to their moms, those first crucial hours. They like to call that first hour the golden hour, and we actually don't even really interrupt moms and babies at all during that time unless we need to. Babies know how to breastfeed. They come out knowing how to do it. They don't need to be taught. So it's really important for moms to be able to be comfortable and not interrupted and not anybody taking their baby away from them. And the baby is given those opportunities to latch on and stay there as long as they want. And it's really crucial for babies in that first few minutes and hours to be able to be stuck there with mom and attached to mom and nursing. And that little bit of colostrum that they get is a really small amount. It's literally drops that they're getting, but it's magical, honestly. That those first drops of colostrum are cleaning out a baby and making their digestive system start to work and all of their metabolism to be set. And it's really important that first little bit after birth.
To add the microbiome too, it starts from there.
And so why might a home visit at day 3 or 4 for a client help continue to facilitate that?
That's usually when milk comes in for moms. So that's a big day for moms, is that time when they're transitioning from that early colostrum to mature milk. Babies are going to get a lot more from moms. It's really important to have that relationship go uninterrupted. As midwives, we're checking for tongue ties and lip ties and cheek ties, and we're making sure that the baby is latching properly and mom is not suffering from any pain. Those are things that can really make or break breastfeeding. And if you don't have the support and you don't have somebody checking in on you and making sure that those things are going well, a lot of times moms, they may give up because they don't have that help. And it's really, really important to have those visits and be having somebody come into your home, and a mom not have to be leaving her house after she's just had a baby.
Absolutely. And so that's one of the reasons is we really don't like to see women leaving their homes for just that first week. We want them to be treated kind of like a princess. But I bring up that day to 3 to 4 visits so that you can see that a midwife will help facilitate that baby is putting on weight and having those wet and poopy diapers, and that you feel confident. The other exam that I want to talk about is we do a 24 to 48 hour home visit as well. And at that 24 to 48 hour home visit, besides just helping facilitate that breastfeeding relationship, there are also some exams that we're offering. One of them is the metabolic screening, or it was previously for a lot of years referred to as the PKU test, but nowadays they test for 40 or more different metabolic disorders. It is also referred to sometimes as the heel poke, and the thing that we like the least, I think, of our jobs.
Yes,
I used to take
it
is. I used to take all of my girls with me to my postpartum visits until one day they were like, "Mom, I hate that you poke those poor babies' heels." Although all of our clients have the opportunity to say no to any exam, we really feel like a pretty non-invasive way of testing for those different metabolic disorders. And although we've seen very few come back with a problem, when you do have one of those problems, that is the best way to have the best information to move forward in your relationship with your child. One of the other screenings we offer is a heart screening, where we're simply taking a newborn pulse oximeter, which we all carry here at Well-Rounded Mama, and we're attaching it to the baby's right hand, right foot, and we're looking for a set of numbers to make sure that we can rule out any congenital heart defects. And so again, we are doing very close follow-up for your baby during that newborn time. There are women's options for vitamin K, erythromycin, and so there, although we haven't gone into depth, we could certainly go into depth in a further video for you. If you are interested, post down below that you would like more information about those kinds of options, but those in and of themselves are enough information to kind of talk about. The only thing that we are not able to offer a newborn during those first 48 hours is we cannot administer vaccines and we cannot perform circumcisions. Those really are the only two things in those first 48 hours that we aren't able to do. Ever. We're never.
We don't do
but sometimes in hospitals they do those things in those first couple days, and they're things that we don't offer. All of the other tests, medications, information, all of that are things that we can offer the client. Camilla, do you want to talk to individuals about their very first 1 week office visit?
The first outing out of the house. Moms and babies come here, so sometimes they're late because getting baby out requires a lot of equipment.
Yes.
But it's really sweet to see the clients at that first week after the baby is born. We're monitoring the baby for weight gain, measurements, and seeing like how breastfeeding is going. And this is what makes the difference, is the continuity of care that a midwife offers, because we've seen baby, the same person has seen the baby from the first latch throughout this relationship that we established. So that first week, we are also checking the baby for jaundice, how all those things are going so far.
Wonderful. Another thing that we offer at that 1 week visit is we're able to complete birth certificates as well as order Social Security cards. Everything is done online. It's super simple. I'm always surprised how many people are like, "Oh my gosh, you had a home birth? How in the world are you gonna get a birth certificate?" And so here, as CPMs in the state of Nevada, we all have accounts at the Department of Vital Records and can perform birth certificates. In fact, although midwives here in Nevada are not legislated, there are a couple things that we are required to do. And one is to carry erythromycin, and the second one is to file proper and correct birth certificates. That's actually the only two things that I'm aware of that I'm expected to do. There's rumors that they're going to require the heart screening, but I don't think that's
NRP requires us to do that.
Yeah. But I don't think the
Got
state
that covered,
does.
I guess.
We're ahead of the game. We are. Oh my gosh.
Ahead of the game. Yep.
Tiffany, do you want to talk to them a little bit about what we do at that 2 week office visit?
At your 2-week visit, we offer a hearing screening for baby to check and make sure that they can hear. And if they don't pass that hearing screening, then we will refer out for further testing and to see an audiologist to check and make sure that they are able to hear, or if there's another issue going on. And we also weigh the baby again. We check baby for weight gain and making sure they're growing properly. We talk about milestones. We visit with mom and baby, and we make sure everything's going well and baby's doing well with their growth, and also how mom is doing, and how breastfeeding is going, and how she's doing emotionally. You're kind of a whole package when you become a family. So we like to check in with everybody and make sure that we're giving all the care that we need and that a mom would need for their baby.
So at that 2-week visit, we also might follow up with a metabolic screening depending on
Yes.
what those options look like. So we certainly don't limit ourselves to these particular visits. Just so you're clear, we have the ability to create custom care for our clients depending on what they need. Some clients might need more visits, and there's no additional cost to that. Our clients might need to meet with our therapist or a life coach or a lactation counselor here, and insurance certainly helps facilitate that, or Well Run a Mama has some scholarships for lactation help. We have an amazing lactation counselor here. The very last appointment that we see you in generally is the 6 to 8 week postpartum visit. And at that visit, that one really is for mom. That is to make sure that she healed, she's well, it's okay for her to return to the gym, return to work. Unfortunately, in the United States, that's a really common conversation that we're having, even though we think it should be much longer than that. We also spend time talking a little bit about birth control and family planning, as well as offering well women care at that appointment. We can do pap smears. That's something that we get asked about a lot, is we're really excited that our clients get to continue that well women care with us, and that we can continue doing pap smears and wellness exams. Thanks for tuning in. That's just a few examples of what we offer for newborn care. It's certainly not the end all be all, but it gives you a really good idea of just how thorough midwives are in caring for families and their newborn. If you liked this video, like, subscribe, ring the bell.
Please.
If you would like to talk to one of our birth professionals, certainly call the front desk. Our information you can be found down in the box below. Thanks again, and I'll tune in. Thanks again, and we'll join in next week with our next topic. Sometimes I have these shy little toddlers that come into my office, all prenatal care, that are hiding from me and shy. And I swear, the moment after I go into their home for the birth, now we are like
Best
this.
friends.
I am
Where's
their
Miss
favorite
T?
person.
Sherry.
Yes, yeah.